What does ADHD even look like in children?
ADHD, the diagnostic criteria we use right now are pretty poor. They are only validated for children ages 6 to 12, and they are all behaviorally based criteria. The kid is up and out of his chair without permission. It blurts things out, has a flash temper. It looks at the behavior, but then it consciously and totally disregards everything else. The fact that people with ADHD think differently, how they regulate their emotions, and the sleep disturbances that at least 80% of people with ADHD have to contend with. It ends up in the school system. A lot of kids do perfectly well in school because kids with ADHD are much brighter than the general population. The average IQ of a person with ADHD is 123. That's all the IQ that a person needs to do anything they want. So usually what brings a child in the school system is their misbehavior, their impulsivity, they're obnoxious and disruptive. That's usually the squeaky wheel that gets people's attention. Somebody who's making at least passing grades, sometimes straight A's, and is well behaved, nobody's going to think of ADHD.
Right.
That's also why we no longer are thinking of ADHD as a childhood disorder. Right now, the average age of diagnosis in the United States is 31.
Wow.
That means that more than half of people are being diagnosed after 31. People with ADHD are incredibly bright. They're first-class problem solvers. You have to think of ADHD as a lifespan condition. We now know it's genetic. There's at least one parent, there's at least one grandparent, and there's a 50-50 chance that each sibling will have ADHD. When you diagnose one person with ADHD, your work has only just begun.